the collecting stool specimen for culture. So, collecting stool specimen for culture involves obtaining a sample of feces to test for the presence of bacteria or other microorganisms. So the purpose of collecting a stool specimen for culture is to find germs that can cause an infection caused by bacteria or a fungus. So the equipment needed for collecting stool specimen for cultures typically includes a clean container, a gloves, and a tongue depressor or scoop for collecting the sample. So considerations before, during, and after the procedure. Before the procedure, it is important to ensure proper hand hygiene and provide clear instructions to the patient. During the procedure, it is important to maintain cleanliness and avoid contamination of the sample. After the procedure, the sample should be properly labeled and transported to the laboratory in a timely manner. So things to document after the procedure. Collecting stool for specimen, it is important to document the date and time of the collection and the patient's name and identification number and any relevant observation or instructions. So explain the procedure to the patient. Instruct the patient to certificate in a bedspan or bedside commode, and if possible, do not contaminate the specimen with your urine or your menstrual discharges. Void before the specimen collection, and do not place a toilet tissue after identification because toilet tissue might be a complication for the analysis, and notify me if you have already identified in the bedside commode. Okay, while the patient is defecating, I will be wearing a clean gloves. Okay, do not contaminate the outside of the specimen container. So the amount of stool to be sent depends on the purpose for which the specimen is collected. Usually about 1 inch of foreign stool or 15 to 30 ml of liquid stool. That the specimen labeled and the laboratory patient have the correct information of them and are securely attached to the specimen container. Then send the specimen to the laboratory immediately, and in some instances, refrigeration is indicated to prevent contamination, and never place a stool specimen in a refrigerator that contains food or medication. So document our relevant information. Record the collection of the specimen of the client's chart on the nursing care plan. Include the recording of the date and time of the collection and all nursing assessment such as the color, odor, and the consistency and amount of the feces. So that's all. Thank you.